All right, guys, we're back. We're going to dive into Medicare Advantage plans. Again, just a quick, simple overview. Medicare Part A, or Medicare, has two parts, Part A, Part B. Medicare Part A has a deductible, Part B has a deductible. Then you have a Part B premium. And then any billable item that falls under Part B services, which are all medical, you're going to pay 20% of those costs. So another opportunity is enrolling into what we call Medicare Advantage plans or Part C plans. So Part C plans are private companies that contract out with Medicare. Medicare then pays a lump sum amount of money to that Medicare Advantage provider. That Medicare Advantage provider then provides services for your Part A and Part B of Medicare. And just one of the rules that Medicare set up when they rolled out Medicare Advantage plans or Part C plans, Medicare Advantage has to be equal to or better than original Medicare. It's going to always be better than, because Medicare Part A and Part B services on Medicare Advantage plans do not have deductibles. Typically, the only two items that are going to have 20% billable rates, or three items, is going to be durable medical equipment and prosthetic devices. So durable medical would be like a wheelchair. If it's $100, you'd pay $20 for it. Prosthetic devices would be like a prosthetic leg, so you'd pay 20%. You're also going to pay 20% of Part B chemotherapy drugs or Part B drugs. And we're going to cover at the end how to cover those costs for like Medicare Part B chemotherapy. That's typically the most expensive item that can occur for Medicare beneficiaries that enroll into Medicare Advantage plans. And I'm going to cover exactly how to cover that cost in a simple way that you don't have out-of-pocket costs and risk when it comes to Medicare Part B chemotherapy drugs or chemo treatment for cancer. So Medicare Advantage plans are contracted with Medicare. Medicare pays the Advantage company. The Advantage company administrates all the Part A and Part B services. Medicare Advantage plans typically include prescription drug coverage. So you will see them advertised as Medicare Advantage prescription drug plans, or MAPD plans. You may have heard that acronym before. MAPD just means Medicare Advantage prescription drug plans. Okay, so Medicare pays that Advantage carrier. The Advantage carrier basically provides coverage for your Part A and Part B. Now, one of the things, an age-old question is, do you lose your original Medicare when you enroll into a Medicare Advantage plan? And the answer to that question is no. You have to have original Medicare Part A and Part B to enroll into a Medicare Advantage plan. If you're on Part A and Part B of Medicare, it enables you to enroll, or what I like to say, it becomes the key that unlocks the door that allows you to enroll into a Medicare Advantage plan or other plans like Medicare Supplements or Medigap, for you guys that call Medicare Supplements Medigap or Medigap Medicare Supplements. Either way, you have to have Part A and Part B of Medicare. You have to have both of those parts to form, in a sense, this key. And this key becomes the gateway into a Medicare health plan like Medicare Advantage, okay? So you don't lose your original Medicare Part A and Part B, but you don't have to use your Medicare when you go to the doctor. You're going to take that Medicare Part A and Part B, the red, white, and blue card, you're going to put it in a safe spot, because you're going to be issued a Medicare Advantage card. It's going to be one card that does everything for your medical, hospital, medication, anything that you need when it comes to your health care is going to be driven in and through that one card with that carrier. There's multiple carriers depending on the area that you live. If you're here local, there's about 7 or 8 different carriers that you can choose from, and we typically, again, are going to look at your doctors, your medication, your plan needs, and choose which plan is going to provide you the most coverage at the lowest cost. So that's really the process that we take, that I talked about at the front end, of taking your medication, doctors, putting it into our plan finder software, hitting a button, figuring out what plan is going to be the best fit, then walking you through the details of that plan. So let's get kind of into the details of the Medicare Advantage and what makes it a little bit different and sometimes can be a great fit. We probably have about 85 to 90% of our clients enroll into Medicare Advantage plans. Now, understand, in Middle Tennessee, where we live, there's a huge network of doctors, hospitals. Our office is just right outside of Nashville, Tennessee. Nashville has access to some of the highest level health care in the nation, so there's not really an issue with accessing care when it comes to network of doctors, specialists, hospitals, and things like that. So a lot of times people enroll into a Medicare Advantage plan in accordance to what access of care do they have or access do they have to their doctors and things like that. So if you're in a rural area or maybe a state where it's spread out and there's not a huge population of large metro cities, yes, it's going to be a little bit harder difficulty for you accessing quality of care. Maybe you have to go in 3 different directions to access your doctors, or maybe a different direction to access hospitals. Then that's going to fall into a situation where a lot of times we would provide guidance to somebody towards a Medicare supplement or a Medigap plan. But because of Middle Tennessee being the mecca of healthcare, we find a lot of people just want to enroll into a Medicare Advantage plan. We walk through the difference of both plans, like I'm doing with you guys now, allow you to make that decision for yourself, and then we look at what plan is going to be the lowest cost for the co-pays, medication. It's going to cover your doctors, which is a huge thing for us, and I know it's a huge thing for you to ensure that you're going to enroll into a plan that still covers your primary care doctor, that it covers your specialist that you're going to see, and then covers your medication. I mean, obviously those are 2 major factors of you accessing care. So we look at it as a continuity of care situation where the health plan should create continuity of care, and continuity of care is giving you access to the doctors you need to see and covering the medications and covering the plan needs and things that you need when it comes to you as an individual. So it's going to combine Part A and Part B services. It's going to cover hospital care, medical care, doctor visits. It's going to typically, again, the MAPD or Medicare Advantage prescription drug plans are going to cover medication. If you're a veteran or you're on a plan that covers your medication, you can qualify for what they call as a Medicare Advantage only, which only cover Part A and Part B services of Medicare, because you may go to the VA and get your medication through the VA, but you may want to have access to better quality care or access of a better network of doctors outside of the VA. And a lot of Medicare beneficiaries will enroll into a Medicare Advantage only plan. And a lot of times those plans are going to pay down or buy back some of your Part B premiums. So the plans are all different depending on the area, the county. Your plan is driven by the county that you actually live in. So I've had people before call and say, hey, my friend Betty is enrolled into this plan. I want to be enrolled into the same plan. She was telling me about the benefits. I love the benefits. Can you enroll me in that plan? We look up and determine that Betty is in this county A, and then all of a sudden, Susie is in this county B, and the particular plan that Betty is in is not in that county that Susie is in. So we have to explain to them, hey, that plan is not available. And they say, well, we're in the same state. Why isn't it available? Because Medicare Advantage plans are driven by the county that you live in, not the state that you have your destination or you live in. Okay, so it's county driven by the plan. Again, we would look that up for you and make it simple, but for your knowledge and understanding, it's driven by the county that you live in. That's why you could be in an Aetna PPO plan and your friend be in an Aetna PPO plan, and the co-pays may be different if you compare side by side your plan benefits, because those 2 plans can be filed with the federal government differently. And the co-pays can be different based on the county, based on the population of the people in those counties, and all these different contributing factors that the federal government looks at and the health plan looks at when they file these plans with Medicare. So it's going to cover much more on these Medicare Advantage plans. They must be, again, equal to or better than original Medicare. So by law, they must cover the Part A and Part B services always. So when you have somebody tell you that Medicare Advantage plans don't cover Part A and Part B services entirely, they are not telling you the truth. Medicare Part A and Part B services have to be covered by the Medicare Advantage provider. Now, sometimes there's restrictions or access to certain services, or the doctor just has to say, yes, they need to have this done and send something into the carrier. Where on original Medicare, if it's a Part A and Part B service, you can just be issued to go get therapy. Sometimes in therapy, like physical therapy, they have to do, they just have to confirm that the doctor wants to have that done, send it into the carrier to get it confirmed that the carrier is okay to have 12 sessions done for physical therapy. There's a process there of management within that health plan sometimes, but the Part A and Part B services in the entirety of all the Part A and Part B services that are on original Medicare, the Medicare Advantage plan has to cover those equal to or better than original Medicare. So there's sometimes just some rules and guidelines for those plans, and we're going to cover those, why those are and how that applies to the type of plan that you choose or may be looking at choosing. So additional benefits that are included in Medicare Advantage plans, and this a lot of times is why some people choose Medicare Advantage plans. I typically tell people, my clients, I typically say I am not going to enroll you in a plan based on these additional benefits, because these additional benefits that I'm getting ready to cover with you, they change every year. Sometimes they stay about the same, but usually they change. Sometimes they add, they take away. The additional benefits are not something that are falling under Part A and Part B services. What does fall under Part B and Part A services are, and important to you is, are my doctors covered, my medication covered, and if this happens to me, is it going to be covered by the plan? I typically look at those services or those details of the plan first, and then the additional benefits is just extra. It's like free pie given to you at the end of a nice meal when you go to a restaurant. Hey, I'll take the free pie. But a lot of times people still enroll into the Medicare Advantage plans based on these additional benefits. Now, if you're fixed and low income and you're on Medicaid or a form of what we call in the state of Tennessee, it's called TennCare, but Medicaid, and 100% of the cost of everything for you is zero, you typically would enroll into one of these plans based on these additional benefits because you're not getting these through Original Medicare. Those that are on Original Medicare will not get these benefits through Original Medicare. They're only going to get access to these benefits through Medicare Advantage plans or by buying individual insurance policies that cover these items, okay? So these items include like dental, preventative and comprehensive dental, depending on what your need is. These plans now sometimes have $2,000, $3,000, $4,000 of preventative and comprehensive dental. It doesn't cost you anything. It's part of the benefit packet, and you're able to use and access care when it comes to dentists that are in a network, or sometimes it's a dental allowance. That just means you can go to any dentist. The allowance pays the dentist. You can go to anywhere that you want to access care when it comes to your dental needs. Vision and eye care. So it'll cover eyewear allowance, routine eye exams. So Medicare doesn't cover routine eye exams. These plans often cover routine eye exams. Then if you need glasses, it's providing you a vision allowance on top of the routine eye exam being zero. It'll provide you an allowance to go towards frames, lenses, contact lenses, and things like that. Hearing aid benefit. These plans, Original Medicare does not cover routine hearing exams. The Medicare Advantage plans typically will cover them at no cost. On top of that, they can have a copay to access a hearing aid, or they'll give you an allowance up to sometimes $2,000, $3,000, $4,000, $5,000 depending on the plan. Everything depends on the plan. That depends on what county you live in. So again, doing a review allows us to look at that within a few seconds and tell you what exactly you qualify for and what plan is going to provide you the most benefit, okay? So transportation. You may need transportation to and from the doctor or medical services, and some of these plans provide that. Now we're seeing these plans provide over-the-counter benefits that allows you to buy things like vitamins and daily toiletry items that won't cost you anything. You can use the benefit for the over-the-counter benefit to purchase those things. Now there's Healthy Club rewards programs where they provide you a credit card. You can go in and buy essentials like commodity goods, certain meats and things like that at certain grocery stores, and you use basically like a debit or credit card, and it gives you an allowance monthly or quarterly to buy things like that as well. There is so much more on the additional benefits. Depending on the county and the area that you live in determines which plan that you qualify for when it comes to Medicare Advantage and those additional benefits. And again, to get into that would mean just calling with a list of your doctors and medication. Let us do a plan review for you. It doesn't cost anything, then we can walk you through the process. So again, what does Medicare Advantage plans cover? Part A and Part B services are going to be covered under Medicare Advantage plans. Your cost share is going to depend on the plan that you enroll into. So it may be zero to the very small copay amounts that you pay. So on Original Medicare, you have deductibles. On a Medicare Advantage plan, you have no deductibles. On the 20% services that Medicare Part B charges you, on the Medicare Advantage plans, typically you're not going to have a 20% charge, you're going to have a copay amount. Other than those three items that we talked about earlier, the durable medical equipment, prosthetic devices, and Part B chemotherapy or Part B drugs. That's billed at 20%. Again, all the other services, like when you go to the doctor, a primary care doctor, you may pay $0 to $10 or $15 copay, usually 0 to 10. To a specialist, you may only pay $5 to say $40 copay. To have an outpatient surgery done that's $20,000, you may only pay $150 to $350 copay. Depending on the plan, Again, we look that up for you and kind of walk you through what's called the summary of benefits. The summary of benefits is going to tell you the copay amounts for the services if you go into the hospital, if you go in to have something done, if you go in to have minor surgery, if you go in to have diagnostic exams and things like that done. And all depending on your specific needs determines what plan is the best fit for you. But Medicare Advantage plans typically are going to cover a lot more the percentage of the cost than original Medicare. So you're not going to have the deductibles, the co-insurance amounts. You're going to have small, zero to low copays that you owe for the Medicare Advantage plans. So let's take a break, and then we're going to dive into Medicare, the types of Medicare Advantage plans. We're going to cover these very quickly, and then we're going to get into another health plan option that's really available to you. At this point in the game, you may say, Kelby, I've heard enough. You know, I realize that you guys obviously know what you're doing. You're communicating a lot of information, and you really have connected in with kind of our story and how our narrative works of helping and guiding you. And you may just want to call and go ahead and schedule a time for a review. But if not, and you're enjoying the educational approach to us walking you through how Medicare works and your health plan needs are, we're going to be diving into the types of Medicare Advantage plans in just a second. See you back in a moment. Thanks.